How does stress impact epilepsy seizures? Have you ever wondered how stress can affect epilepsy and seizures? Stress is a well-recognized trigger that can increase the frequency and likelihood of seizures in people with epilepsy. Both short-term and long-term stress can impact seizure activity by lowering the brain's seizure threshold, making seizures more likely to occur. Many individuals with epilepsy report that stressful events or periods of high stress often precede their seizures. Research supports a strong link between elevated stress levels and increased seizure frequency. The connection between stress and epilepsy involves several mechanisms. First, stress activates brain regions that are involved in emotional processing and seizure generation, such as the hippocampus and amygdala. Chronic stress can lead to changes in these areas, including the loss of certain neurons, which may worsen seizure control. This dysfunction can create a feedback loop where seizures and stress exacerbate each other. Additionally, stress often coexists with anxiety and depression, which are common in epilepsy and can independently increase seizure susceptibility. Depression may play a role in the relationship between stress and seizure frequency, highlighting the complex interplay between emotional health and epilepsy. Behavioral and lifestyle factors also come into play. Stress can negatively affect adherence to anti-epileptic medications and disrupt sleep quality, both of which are critical for seizure control. Furthermore, the social and emotional challenges faced by people with epilepsy, such as stigma and low self-esteem, can heighten stress levels. It's important to note that individual experiences can vary. Some patients, particularly those with temporal lobe epilepsy, may be more susceptible to stress as a seizure trigger due to the involvement of the limbic system. Many patients report being able to predict seizures based on their stress levels. From a practical standpoint, managing stress is a vital part of epilepsy care. Techniques such as stress reduction strategies, counseling, and support for mental health conditions can help reduce seizure frequency and improve quality of life. However, stress management should complement, not replace, standard medical treatment prescribed by healthcare professionals. In summary, stress impacts epilepsy by increasing seizure risk through neurobiological changes, emotional comorbidities, and behavioral factors. Effective epilepsy management includes addressing stress as a significant seizure trigger while maintaining comprehensive medical care. Remember, if you have concerns about your epilepsy or stress management, it is always best to consult with a healthcare professional for personalized advice.